Hello, everyone, and thank you so much for joining me for Daily Spark TV. I am your host, Dr. Angela Butchester. My guest today is Dr. Susan Rich, and I'm so excited to talk to her today. Her book is entitled The Silent Epidemic, and boy, are you in for a treat. I've had the opportunity of speaking with her for Daily Spark Radio, and she is such a wealth of information. So go on, get comfy, get cozy, because we are about to get started. Hello, Dr. Susan. Thank you so much for joining me today.
Hi, Dr. Angela. Very great to be here. Thank you so much for having me on your show.
Of course. You are such a wealth of information, and I love your personality, and I'm so glad that you were able to join me today. Now, before we talk about your book, I want to ask you a little bit about who you are. I didn't want to read a bio, but I do want to ask you, what makes you Dr. Susan Rich?
Well, I am a child, adolescent, and adult psychiatrist. I have a Master of Public Health and Health Policy and Administration, and I've had over 14 years experience working with children with neurodevelopmental issues, especially fetal alcohol spectrum disorder, which is the topic of my book. And I've had really over 28 years experience in that field, even prior to doing medical school and my public health degree.
Now, I love all that you are able to do. And I love it when people have degrees in things that allow them to not only talk about one thing, but a spectrum, using that word, a spectrum of things, because it allows us to delve a little deeper into the conversation. Now, before we talk about the disorder itself, I wanted to ask you about the title of your book, The Silent Epidemic. It is quite intriguing, great title. Why did you decide upon those words for your title?
Well, the silent epidemic is really related to the fact that this has been endemic, meaning at a low level in the population, and at times epidemic, depending on what time in history that alcohol is being used. We've had this condition around since, the time of the Vikings, really, when people were raping, pillaging, and burning all over Northern Europe and half of North America. But having said that, at times this condition of prenatal alcohol exposure happens in a society like here in the United States in epidemic proportion. And that's really what we're dealing with now. Alcohol use rates went up by 400% from 91 to 95 in pregnant women, so moderate to heavy use. And so what we're seeing now in youth is a number of youth who are affected that were actually born, say, 95 to 2000. And those are the ones now ending up in the correction system, the juvenile justice system, with substance use issues, learning disabilities, autism, ADHD, many other problems. Not saying that those are the only causes, but it's probably the leading preventable cause of neurodevelopmental issues. And the rest of the title of the book, so The Silent Epidemic, really because it's silent, nobody knows about it. I'm trying to raise awareness. But A Child Psychiatrist's Journey Beyond Death Row is the second part of the title. I have been to death row in about 5 states. I've helped get people through the appeal process of having their case understood as being as a consequence of their neurodevelopmental issues. And I believe as a society, we need to go past that and understand that these children can be helped, but we have to start at a very young age. We have to start when they're young, being able to help their families, support them with services, and to be able to help society understand them as having neurodevelopmental problems rather than being willful or having conduct disorder or all of these other conditions that society will put upon them and put them in jail or prison.
Absolutely. And boy, have you said a mouthful, because we do know that due to having these types of conversations, that we are looking at our children and their behaviors as early as elementary school and projecting where they will go and what their futures look like. So you are most correct. Now, being an author, is that something that you always wanted to do, or did you find that that was just the next logical step along your life path?
Well, I've ever since learning about prenatal alcohol exposure and the impact on our society, and really how many young women don't know that this is a problem, especially before they find out they were pregnant. I kind of knew all the way back then that book hadn't been written. I did read a book which led to me leaving a job in pharmaceutical research to go back to school to do a Master of Public Health. I actually read a book called The Broken Cord, which inspired me. And eventually I was hopeful when I started writing my book that I would be at a place where I could help young women and policymakers, legislators, parents of these children to understand what this problem is, so that we could start to help solve it rather than just relegating these children to jails and prisons. So it's not that when I was 10 years old, I thought, oh, I want to write a book one day. As a result of finding out about this, it just was such a compelling issue. And it really touched my heart in such a way that I needed to get it together to get the book written so that people could understand this very misunderstood and under-recognized condition.
You are so right. And my next question for you is, and you kind of touched on it a little bit before, and that is, most people are familiar with fetal alcohol syndrome, but you are talking about fetal alcohol spectrum disorder. It sounds like you're kind of even zooming out a little bit more and telling us, hey, there's a lot of layers to this. Can you tell us a little bit more about the spectrum disorder?
Yes. So fetal alcohol syndrome actually accounts for only about 10 to 15% of children who are affected by prenatal alcohol exposure. Another, say, 85 to 90% of them have a wide range of conditions that we consider more neurodevelopmental or neuropsychiatric. And that is, a range of learning disabilities, ADHD. Some of them have social communication problems that look a little bit like autism spectrum. Now, the difference between fetal alcohol syndrome and the broader term is the face. So the ones who have the facial features recognized as the fetal alcohol syndrome, that occurs in the early part of pregnancy, late third, early fourth week post-conception, with as little as 4 drinks at a clip. So if the mom drinks as little as 4 drinks, which would be less than a Long Island iced tea, which has 6 shots.
Right.
So 4 servings of alcohol, 4 to 5 servings, late third, early fourth week, is enough to cause the full-blown fetal alcohol syndrome. Now, which affects the face, it affects the learning, attention, lots of issues in the brain, and it can affect growth. So the children have a hard time growing and thriving, whereas fetal alcohol spectrum disorder is considered a wider sort of diagnosis, and really it is not a diagnosis itself. The diagnosis is neurodevelopmental disorder associated with prenatal alcohol exposure, and that's the second part of the title of my book. So understanding, treating, and preventing neurodevelopmental disorder associated with prenatal alcohol exposure, ND-PAE. So FASD is kind of the umbrella term that takes into account fetal alcohol syndrome. And then the other diagnosable term besides fetal alcohol syndrome is neurodevelopmental disorder associated with prenatal alcohol exposure. And that, psychiatrists can make the diagnosis, a developmental pediatrician, a neuropsychologist. There are a variety of people who can make that diagnosis, but many of these children are not getting properly diagnosed. And that's really the bigger problem.
It sounds like it. Now, would you suggest then that moms, when they find out that they're pregnant, that they should really start getting that prenatal care? Is that really important? Is that one of the first things that they could do? Of course, besides, don't drink while you're pregnant, but should they really make sure that they are getting that prenatal care?
So here's the rub, and this is what launched my whole career after learning about this problem. Is if you wait until prenatal care, it's already too late. Most OBGYNs will not see you prior to about 8 to 12 weeks post-conception. And if she stops drinking 8 to 12 weeks post-conception, a lot of damage has already occurred. So what we know is that it's the late third, early fourth week, in those periods of time before the woman even knows she's pregnant, that her baby could be affected. So the best choice is to contracept if you're using alcohol. That is, use family planning techniques. It could be just avoid having sex. It could be avoid alcohol if you're not using contraception, but be preconceptionally healthy. Take care of your body before you are intending to get pregnant. Go to your OBGYN for a preconception health visit. This is what the Centers for Disease Control is saying. So go on the Centers for Disease Control website. They have a huge push now. It's a huge program, preconception health promotion. Get on a multivitamin. Have your spouse stop drinking. Have him use multivitamins. The sperm takes 3 months to develop. And from the time that the sperm are born in the man until the time they're ready to conceive a baby, it takes 3 months. And his use of alcohol can also affect the way the baby develops. It causes methylation child, yes, for the offspring. And those changes can actually keep going for generations within that family, because the man used even 5 generations ago. And that part we've actually known since the early 1900s with a teratologist named Charles Stockard, Dr. Charles Stockard. All his work is in the archives of Cornell Medical Center, but he did research in guinea pigs and fish showing that even as, the males use their offspring, even if it's only the male, that 5, 6, 7, 10 generations later, you can still see effects on the offspring. So women should avoid any alcohol prior to getting pregnant. They should have healthy bodies. They should take precautions from getting pregnant if they're using alcohol. They should either not have sex or they should use contraception. Now, the majority of pregnancies in this country still, over 50% are unplanned. In this country. And so that's the bigger problem, is that most women don't know they're pregnant when this is occurring. I just had a conversation the other day with a mom who is she's very bright, educated, from Baltimore. She has worked in the public health and social services sector for all of her career. She's had 3 children. None of the 3 by her husband were planned, and they were social drinkers, and she would go out drinking and have fun with her friends, which is totally fine. There's nothing wrong with it. And this happens to a lot of women. They'll be out on their honeymoon. They'll have, drinks. Maybe they're on a cruise and there's lots of alcohol on these cruises. Who's to say it's that woman's fault? What about putting the onus on the alcohol industry to say it's their duty to warn? And I've written a paper on that topic, which is in an international book on fetal alcohol spectrum disorder. It's on legal implications of fetal alcohol spectrum disorder. And I've also talked about it in my book, just how little the alcohol industry is responsible for, this condition.
Right. Now, I hate to cut you off, but it is time for us to go to break. But before we do, Dr. Susan, can you remind everyone the title of your book? And if you could just, raise it right under your chin, we could see a copy of it as well. Can you remind everyone what is the title of your book and where can we get a copy?
Sure. It's The Silent Epidemic, A Child Psychiatrist's Journey Beyond Death Row. You can get a copy on Amazon. You can look at the prenatalalcoholexposure.com website, just prenatalalcoholexposure.com. I also have a YouTube channel. I would love to get 1,000 subscribers. I actually read portions of my book on that YouTube channel for free. That is The Silent Epidemic of Prenatal Alcohol Exposure. So if you type that into your URL on YouTube. And then I also have a Twitter. It's at Susan D. Rich MD, Susan D. Rich MD. And, there's all kinds of ways to access the information.
Gotcha. Alrighty, everyone. We'll be back right after this.
You could be spreading the coronavirus without realizing you have it, so do your part and stay home. It's important to limit in-person interaction with anyone outside of your immediate household, but phone and video chat are safe ways to connect. It's also important to limit social gatherings. If you need essential items like food and medicine, try using a delivery service. If you must leave your house for essential items, or if you want to take a walk for exercise, make sure to wear a cloth face covering. Stay at least 6 feet away from other people. Try not to touch frequently touched surfaces like light signals, street signs, or benches. And wash your hands with soap and water for at least 20 seconds as often as possible. This advice applies to people of any age, including teens and younger adults. It takes all of us to slow the spread of the coronavirus, so stay home unless absolutely necessary. Visit coronavirus.gov for the latest information.
And we are back. Thank you so much for joining me for Daily Spark TV. I am Dr. Angela Butts-Chester. My guest today is Dr. Susan Rich, and we are talking about her book, The Silent Epidemic. Now, I love talking to Dr. Susan, and we could talk all day, which we, if we had the time, we would definitely do that. But we are talking about something that I think very few women actually know about. You know, this information that you're sharing with us, Dr. Susan, no one has ever shared with me. It is amazing what we do talk about and what we don't talk about when it comes to our health. So thank you so much for coming on and sharing this bit of information. Now, my next question for you is, why do you believe that this is such a problem? Do you think that it's, like I said, women just don't know, that they're ignoring the medical advice? Why is this such a problem? Is it our society? What's going on?
Well, it's multifactorial, really, Dr. Angela. So you're a very educated woman. It's not like you don't delve into your own personal health and information for your health. And that's like a lot of women do want to have good health, and they want to have health for their babies. There's a number of problems. The alcohol industry is very poorly regulated on any issue. And if you look even now, you see a lot of advertising with the alcohol industry pushing alcohol into communities of color. Almost every other ad these days with the coronavirus epidemic is for either alcohol or for pharmaceuticals, which the effects that the alcohol is causing. But that said, so the alcohol industry is partly the problem, which has really been so since the original Surgeon General's warning. Alcohol is not really very regulated. It's not at all regulated by the Food and Drug Administration. It's regulated by alcohol, tobacco, and firearms. And if you look at that as a way to regulate this issue, it's not going to happen because it's one of the most poorly funded. It's one of the most smallest of all of the, let's say, regulatory agencies in the government. The other problem is that healthcare providers in general, physicians, nurse practitioners, social workers, all of the different disciplines are not trained on this issue. And what it would take is a massive global change in the way that we perceive alcohol use in general, but also during reproductive years. So it would require revamping a lot of medical training, require teaching doctors and reteaching them. And many doctors do use alcohol themselves, and they don't want to consider that their social drug of choice or any of our social drugs of choice are going to cause a problem.
Yeah.
So that's part of the issue, is that, the doctors, don't really have any stake in learning about this. I mean, so far, our diagnostic and statistical manual has categorized these children as having ADHD, autism, learning disorders, speech and language problems, social communication problems. There's all these other ways of seeing these kids. Many of them have trauma histories, so they end up with reactive attachment disorder and post-traumatic stress disorder. And so they're characterized in many different ways. Not saying that any of those conditions of themselves are only caused by prenatal alcohol, but it's 1 in 20 children. So listen to this number, 1 in 20 in our country, and it's because 50% of pregnancies are unplanned, and 13.5% of childbearing age women binge drink.
Oh, wow.
So binge drink meaning 4 to 5 drinks or more at a time. Yeah. So if you consider lack of access to contraceptives, increased access to communities of color for alcohol. You can buy alcohol easier in a community of color than you can bread. There are not the grocery stores in communities of color. We've talked about this before, you and I, that there are systemic reasons, there are societal reasons. So if you look at alcohol industry, you look at the medical community, then you look at the government, and who is making those decisions about where these alcohol shops are placed. It's the local and the state government. So they say, well, in this community, it's okay to put 10 liquor stores, and we're going to give licenses to 10 different, people who don't even live in this community to run these liquor stores. However, in this other community, we're going to put 10 grocery stores.
Yeah.
And we're only going to have 1 liquor store in that one. But this community over here, we're going to put 10 liquor stores and 1 grocery store. And if you look at it, that's how it pans out. In Ward 7 and 8 in DC, they've got 3 grocery stores between them. I've never counted how many liquor stores, but I can guarantee you it's probably double that.
Yeah. Absolutely. And you are hitting the nail on the head there. And thank you for bringing that to people's consciousness, because so many times when we hear someone who lives in that neighborhood say, hey, we need a grocery store, we're living in a food desert. And they say, well, you have corner stores, but that corner store is really a liquor store that has a few items that you can purchase, and it's usually canned goods. It's not fresh fruits and vegetables. You're right. I am within a walking distance of a major, without saying names, a major brand, a major grocery store that gives me organic fruits and vegetables and organic chickens that have has eaten as well as you and I. So with that being said, you are right. There's a huge difference in how the neighborhoods are planned. Wow, there's someone right now going, oh my goodness, you're right. This is done, and it's done on purpose. I tell you.
Yeah, let me take, and I don't mean to interrupt you, but let me go one step further. The other thing that has happened in our systems, which goes to the community, the state, and the county level, is they don't put the healthcare agencies in the communities where they belong. They put them outside the communities, where in rural areas you have to drive 30 miles to get to the closest public health center where you could get a contraceptive. Whereas if you're like in a rural or even an urban area, you may not have access to transportation to drive that far. For these clinics, they need to be embedded within a 1-mile radius of the communities. And in I think it was Dade County, Florida, I attended a talk in Atlanta at the Rosalind Carter Center or Symposium on Mental Health Policy some years back. And there was a presentation by someone, I think it was Dade County, Florida, where they had embedded a family planning clinic with a variety of reproductive health services and public health services in what used to be an elderly folks home, like one of the nursing homes, but they had abandoned that, but they then revamped it, and half of it was a daycare area for the children to go while their parents were getting their public health needs met, their medical needs and their reproductive health needs and that type of thing.
Wow.
Within I think it was 1 to 3 years of that taking place, the domestic violence rates went down because pregnancies were more planned and they were spaced out to where the women were having a child not every 1 year or every 11 months, but they were having a child every 3 years or every 4 years. Okay. And the women had better access to education and better access to her own well-being because she wasn't constantly having another baby. In Robeson County, North Carolina, where I spent the first part of my public health career, we created a transitional housing community for women in recovery where their children were reunited with them from foster care. So instead of the women, having a baby every 1 to 2 years and having those babies taken away from them because they had relapsed on their substances, they were able to live in this gated community, 4 and 5 bedroom apartments. It was a $1.8 million project to build over 2 years, which we did. It's been replicated 8 times in the state of North Carolina. It's called Grace Court. There go I, but for the grace of God. And really, it is what communities need to start thinking about. The women have access to an on-site community building where all of their public health services are offered. They're provided transportation and childcare. They have to be working or in school as a part of their rental agreement. They get random drug screening, which again, if we're going to tie some of our public health programs to cost benefit analysis, we need to think about how do we help women get, clean and sober, and how do we help them maintain it over the long period so they can keep their children rather than keep having babies. Because we ask the women, why do you keep coming back every 2-3 years with another pregnancy? In some cases, every 1 to 2 years to the halfway house for pregnant women. And they said, because the government keeps taking my babies away from me. Well, of course, if the government is taking their babies away, nobody's taking their reproductive rights away. Right. Nobody's giving them access to contraceptives. Right. In fact, they're making it difficult for them to get it because in that rural area, the public health clinic was 30 miles away from some of where they lived. But we embedded the programs within their gated community. A lot of the women were living couch homeless. They were now having their own apartment. They were able to go to school or work to get back on their feet, be reunited with their kids. They felt so good about themselves because they could parent their own children.
Absolutely.
And those are the kinds of approaches our society needs to start thinking about.
I agree with you. Yeah, I definitely agree with you on that. And thank you so much for that segue, because my last question for you, and we have about a minute left in the show, and that is about your faith. How has your faith with everyone who's on the show, though they do what they do because they believe a certain thing about how life is supposed to be, and you are definitely living that out. You're living for a purpose and a cause. How do you think your faith helps you to walk the journey that you have been purposed to walk?
Do you know, Dr. Angela, I get up every day and I go to bed with the same prayer. Dear God, lead, guide, direct, and protect me. And I added the and protect when I started to go into the halls of death row. And when I started to go to the juvenile delinquency centers and the jails and prisons and seeing these individuals. My grandmother had taught me to say every day, dear God, lead, guide, and direct me. I added protect because I have no idea what I'm doing, only why. And I am Quaker, so I have a very strong belief that each one of us has that of God in them, even someone who's on death row, you see. And I think as a society, until we take a step back and say, we are all here for a purpose. We are all here to have meaning and purpose on the planet. Why are we relegating these young people into society, throwing them into the ditch, making them homeless, making them have mental health problems? Why don't we lift them up, cocoon them, giving them a place to be? And that's why I created my farm, my therapeutic farm, which we didn't talk about today, but that would be for another day.
That's another reason for you to come back on.
Right.
I'd love to have you come back and be able to talk about that, because like I said, you are doing so much and it is amazing the work that you're doing. Like I said, I love your spirit. I love that you are driven by your purpose, that your faith helps fuel you and continues to push you forward. And we will definitely have to see you back on so that you can share about the farm. And I know that someone's going to want to hear even more about your book, because let me tell you, you guys, we just scratched the surface. The show is not long enough. So Dr. Susan, we will definitely have to have you back on. Thank you again for coming on and sharing with us today. Thank you again, Dr. Susan, for being
Thank you
on
for
with me
having me,
today.
Dr. Angela. You're wonderful. I really love your show. Thank you for having me on.
Thank you. And viewers, as always, may the Lord continue to shine his face upon you. May you receive his grace and his mercy in all that you do. Until next time, everyone, have a blessed day. Bye-bye.
Hi, do you have something to share? Be a guest. Want to sponsor an episode? Visit drangela.chester.com. Thanks again for watching Daily Spark TV.